videotape it. It's up to you. All right. Okay. So we find the pulmonary artery right here. Okay. To the rear end of the pulmonary artery, we're going to find the right atrium, which is this one right here. And this right atrium obviously doesn't have all the components, because normally you would have the superior and inferior vena cava, and you can put the probe into them and end up in this chamber. The only thing you could do at this point is when you notice this is a coronary sulcus right here. You open this up, and what you're going to see is you're going to see the tricuspid valve right here. Mm-hmm. The tricuspid valve is anchored by the chordae tendineae, which are this right here, and they are anchored to the papillary muscle, which is right there. That's the papillary muscle. So now what we want to do is we want to find the moderator band, and I found it. Here's the moderator band right here. This is your moderator band. Okay? See that? See that band is really thick? That band is synonymous to the SA node. So there is no moderator band in here. The moderator band is located right here. So when blood enters the right ventricle, blood now is going to go up, and if you follow this up, you're going to end in this chamber right here, and you may be able to see the semiluna depending on it has dry blood. Sometimes depending on the heart, you could stick your probe in here or do it the other way. I'm going to do it the other way so it's easier. And I find my probe coming down this way, and if you open it, look at your probe. Easy. So it went through the semilunar pulmonary artery valves to the pulmonary artery. From here, you can see a couple of things. This is a septum. Okay, this is where all the electrical impulses are going to travel to, this way and that way. Take a look at the thickness between the left ventricle and the right ventricle. The left ventricle is a lot thicker because all the blood has to be pumped to the rest of the body through the aorta. So if we take a look at the layers of the muscles, we have the epicardium, the myocardium, and the endocardium. So the endocardium is always kind of shiny. Okay? So take a look at the ventricle, take a look at the ventricle. The ventricle here is a lot bigger. As you can see, look at the size of this ventricle compared to the size of this ventricle. All right, so now blood went to the lungs, and the blood is going to return to the left side of the heart. And once again, the way they harvest this organ, you cannot see the pulmonary veins that are returning blood to the left atrium. Okay, so the only thing you see is this right here, and that's all. So now we are in the left atrium, and from the left atrium, we can probably see, if we open this up really, really well, right there. You can see that. You can see the valves. You can see that valve, right? You can see that valve. That is the bicuspid or mitral valve, and when you open it, look what you found. The bicuspid and the mitral, or the mitral valve as we call it, right here. Okay? Once again, the chordae tendineae, and once again, the papillary muscles are right attached into that. So this blood vessel is going to fill up with blood. As these two blood vessels contract, these two blood vessels are going to relax, and vice versa. When these ones contract, these two relax. Okay? So now the blood is going to leave this area as both contract. Blood from here is going to go through the pulmonary artery to the lungs. Blood from here is going to go up the aorta to the rest of the body. So now, how do you find the aorta? Well, you can open this up, and you can see the semilunar valves right there. Okay? Yes, that is the semilunar valves. Okay? Those valves right there, the semilunar valves, that's where the blood is going to go through. And that blood is going to go right through the aorta, which is right there, up to the rest of the body. And you can tell the difference between the pulmonary artery and the aorta, because when you know this one is thicker, this one is thick, but this one is thicker. This one is less thick than this one, and this one is in the front of the heart. Okay?